Our oldest child, Dan, passed away a few years ago. Dan had Down syndrome. He had a wonderful life, a life full of friends, family, and his job at Microsoft. He worked there 14 and a half years. His job made his life so very typical. At his birth in 1968, we were asked to institutionalize him, and we chose differently. But at his birth, never did we dream that he would have a real job as an adult. Jobs allow our folks to contribute, to be part of their community, and to teach others about abilities, not just disabilities. Over 19 years ago, King County Developmental Disabilities Division offered me a 6-month grant to organize parents in King County. O'Neill and Associates agreed to launch my job for the first few years. In addition, I have served on the Washington Initiative for Supported Employment Board of Directors. I am telling you this because I've had a good vantage point to observe education and training of professionals working with individuals with developmental disabilities. Teachers, case managers, home support staff, employment specialists. It is so important for these people to have specific training and specific education in order to work successfully with our sons and daughters. Washington State leads the nation in the number of individuals with developmental disabilities who have good jobs. The cost-effective teaching and education we have here is a key ingredient to this success. Thanks.
We reap the benefits of their training, certainly in terms of the people that from supportive employment that are working with us. Through Project Search, we're working with those folks at Eastside Employment and really have seen how much they care about the people that they're trying to place, as well as care about the business to make sure that they're doing the best thing for us. I think the other thing is with some of the trainings that WISE is doing, and talking specifically about the leadership conference last year and really trying to develop leaders in this field. I mean, how do you get folks invested in wanting to help people with disabilities? It's a bit of a challenge. Face it, the pay isn't great. You really have to have a passion for this. And I really appreciated being at that conference myself and seeing that you're really trying to say, okay, you guys, we need to step out and do something a bit different. When that was sort of exciting. And lastly, talking specifically about the work of O'Neill and Associates, if it wasn't for them, I don't know that Children's Hospital would be working with folks with disabilities to the extent that we are, helping us navigate a very, very, you think healthcare is complex. Well, your system is incredibly complex. I'm really understanding how our business works as well and saying we need to do what's good for the business as well as what's good for the employees.
We came in and worked with O'Neill and Associates. We probably started about 2.5, 3 years ago. And in that period of time working with them, we have gotten 27 people jobs at Children's Hospital. We couldn't have gotten to first base with Children's Hospital without the 2 years of groundwork that they laid just to get them ready to bring people in with developmental disabilities. I see it falls into 3 areas in my estimation. Leadership, training, and technical assistance. By leadership, I'm thinking about articulating a vision for where we want people with developmental disabilities to aim for and what we want to aim for with our services. O'Neill and Associates and WISE have been good at not establishing a threshold of what minimum service levels are, but they establish what we should be shooting for and continue to push service providers to improve their services and outcomes for people with disabilities. On the technical assistance side, they help when there are problems along the way. Sometimes we run into obstacles and we need experts to come in and help us troubleshoot them or figure them out. O'Neill and Associates and WISE both provide resources in that regard. As far as training is key. The services that we provide are technical, and the staff that provide the services need to know what they're doing and need to have diverse skills and experiences.
We provide best practices services to people who had traditionally been served in sheltered workshops or in community access and hadn't been given the opportunity to work in the community. Without technical assistance and training and education, those people who have complex support needs could very well have been left behind. So really top-notch, unique for our own specific needs, focused education and training has had huge impact on AtWork's outcomes. 2 years ago, AtWork staff turnover was 60%. AtWork staff turnover today is 10%. One of the biggest reasons that staff stay engaged with an employer is the opportunity for professional development and training. An ever-evolving field, and if you want to stay on top of best practices and keep the best people engaged so that you can be effective and efficient, you need to have people that stick around. So in the long run, it really saves us a lot of money.
So I had the opportunity to go to the Highline Community College course, the Employment Professional Certification, and that really finally helped me to understand what I was doing. So without that course, I would never have gotten as far as I've gotten, and I wouldn't have gotten the people jobs that I really, really wanted to get jobs for.